The reason we've adopted Telestroke for our service is that it extends the options of treatments for patients with stroke. Stroke patients who present early are sometimes eligible for a treatment called thrombolysis, a clot-busting treatment. And to be able to give the clot-busting treatment, you need to have a patient who presents early, that's within 4.5 hours. You need to be able to have a CT scan performed to exclude any bleeding. And you also need a stroke physician or neurologist to be able to provide advice on giving that treatment. Because in some patients, the treatment could actually be harmful. So the plan was to try and get the patient to their nearest hospital as quickly as possible, get a CT head scan done as quickly as possible, and then contact a stroke physician over a video conferencing system so the decisions on whether to thrombolyse or not could be given. What the system allows us to do is to interview the patient, make sure we have a clear-cut time of onset, ask about what drugs they're on, ask about their past history and any contraindications there may be to giving these sorts of treatments. So hopefully through the interview we'll be able to clarify the diagnosis of stroke. We can then, with the assistance of a nurse or a doctor, make a very good assessment of the patient over the system. We can ask them to raise their arms, raise their legs, and you can get quite a lot of information over the video conference system about the severity of the stroke. From there, the patient will usually go to get a CT head scan, and we're able to review the images ourselves in our office or at home over the computers of the images of the brain scan to decide whether they've had a hemorrhage or whether they've had an infarct, a clot causing the stroke. In assessing stroke patients, urgency is very important. When the paramedics will be bringing the patient in, they'll be performing a fast test, face-arm speech test in the ambulance. If they're fast test positive, that they've got a new facial weakness or a new arm weakness or a new speech deficit, then they would be pre-alerting the A&E department that there's a patient coming in with a potential stroke. In A&E, they'll be taking that a little step further, but again confirming the diagnosis of stroke and excluding some of the mimics of stroke. And if they are positive to that, then they'll be doing two things. One will be organising the CT brain scan urgently, and the other thing will be contacting the Telestroke physician so they can start making their assessments and obviously compressing the time down as much as possible. The benefits of the health service are huge. Stroke costs the whole economy, health and social, over £7 billion per year. For the health service, there'll be lower costs because people staying in hospital for shorter periods of time. But the big benefits are in social care. That the dependency for patients who are surviving their strokes will be much less, and there'll be big savings in that area.